Dr. Kevin Kavanagh is a retired physician and is also founder of a national organization called Health Watch USA. Good morning, Doctor.
Good morning, Jack.
Tell us about Health Watch USA, when you started that, what it's about.
Well, we started over 10 years ago. We're a nonprofit organization. We have members around the nation, and we also have some international members that tend to give us some advice of what's going on in Europe and other regions. And we primarily focus on research, especially with infectious disease, looking at healthcare policies, interpreting studies. And we also do patient advocacy. That's another big portion of our organization. So we have a lot of activities, one of which has turned out this year to be being on your show.
That's good. Dr. Kavanagh is with us on Monday, Wednesday, and Friday, and you were concerned, I guess, on Wednesday, or maybe it was Monday, you mentioned it one time, that you were not hearing anything about Chris Christie, and you were concerned because he's a pretty big guy and, went to the hospital with COVID-19. Now, there's some good news this morning in that regard, right?
Well, the good news is they've at least stated he's not on the ventilator and that he stated that he was in good spirits, but it does look like he became pretty sick with this. He's now day 6 in the hospital. So this is a serious type of a virus, and infection can give you sequela afterwards. And so you really do want to follow public health advice, and let's try to avoid catching it.
Did you watch the vice presidential debate the other night?
I tried to, but I'll be honest with you, Jack, I really got distracted with the fly. As soon as that landed, I was just glued. I couldn't take my eyes off of it. I said to my wife, that's the only thing people are going to be talking about. And yes, that's what it turned out to be. But I did watch it.
Okay, well, I think the fly was after they talked about COVID and what they would do if they were in the place to do so. Did you have any kind of takeaway from each of the candidates in terms of their would-be handling of COVID-19?
Well, I'll be honest with you, I really didn't. The talk was much more civil than the previous debate, but it was really devoid of facts. I would have liked to have seen a statement regarding national coordination, enacting the Defense Production Act to make sure our workers have more PPE, looking at school ventilations, getting programs to get businesses up and running and redoing their infrastructure. That sort of material just wasn't there. And I'll be honest with you, I was a little bit disappointed on both sides as far as the content. There was a lot of avoiding of questions, yeah.
Oh, yeah, well, they do that. I read this just this morning. Rapid COVID testing might get easier soon. Doctors at UCLA came up with a new test that only costs $10, and it's much easier process. You just spit in a tube. You toss it in a machine, you get results in about 24 hours. They say just 10 lab technicians can process tens of thousands of tests every day. Tell us what, if anything, you know about this.
Well, that's the saliva test. That is supposed to be a good screening tool. And I think it's important to have the viewers understand that the rapid tests are not going to be as accurate as the tests which are processed in the laboratory. Rapid tests are of two types. It could be either PCR tests or antigen tests, but they're smaller units, they're processed in the field. There is more chance of error, and unfortunately, the error tends to be on the false negatives. And this is why, although they're good to use when you're having symptoms, they're good to do mass screenings with, but they're not really good to do as your only security for people that are coming into an event, because they will have a false negative rate that can be fairly high, especially in those that are asymptomatic, because they don't have the viral load high enough for these tests to pick up. But similar to the PCR tests, if you get a positive result, that is something that you should become worried about and make sure that you go seek medical attention, because they are fairly accurate. Actually, they're very accurate. Now, they'll still have a rate of that's a false positive, but that's quite low. Now, for those of you that are concerned about tests and will call in and say, well, there was this error, there was that error, this person tested positive, wasn't positive, you have to remember we're doing 1 million tests a day in the United States. So even a low rate of false positives will give a few patients that are wrongly diagnosed.
All right, let's talk about the fact, and I was a bit surprised, frankly, that he even admitted this, but Senator McConnell says he hasn't been to the White House since August because he didn't like the way they're handling the COVID-19 protocols. Were you surprised?
Well, no, I wasn't. I've talked with members of both sides of the aisle, and including some of Senator McConnell's people, and he's really right in line with public health advice as far as wearing masks and social distancing. And as you know, Jack, that has always been our stance. We want to open up the economy safely and to stay open safely. It's how can we open up safely? So he is very much following public health advice and encourages Kentuckians to do that also.
The president is making a big deal over how good he feels, which is good. We're glad he feels good, but would love to know, and I guess we won't, how much of that feel good is as a result of the steroids that he's been given. Do you know anything about that?
Well, from taking low-dose steroids myself, I would think a lot of his feeling good is due to the steroids. I mean, it zaps temperatures, inflammation, arthritis, everything. So that's maybe a false sense of security. Now, conversely, when he comes off of steroids, he'll have a crash and he'll feel much worse than what he actually is. And this is one of the reasons why it's probably not a good idea for him to debate, because he's on these medications. And that's something that just goes with the treatment of illness and sickness. And this type of variation in his feelings, that should pass. Well, hopefully it will.
I've heard it referred to as roid rage when somebody's coming down off that stuff. Now, I have heard you say on this program before, and we spent plenty of time talking about the best and the worst masks to wear, and I've noticed that some of the Secret Service agents appear to have the N95 masks with the valves, with the exhalation valves on them, and I've heard you say that's not a good choice.
Yeah, that was really disturbing, and a member of our board picked that up from the video of him when he circled around the White House with the Secret Service agent, and the one in the front passenger seat looked like he was wearing an N95 mask with the escalation valve on it, and those are not recommended for a pandemic. Actually, that puts the president more at risk. He could get contaminated with another type of virus or infection, but it really questions who's advising these guys and what type of PPE they should be wearing. I mean, this is at the highest level of our government. In California, you can't even wear these masks during the pandemic. They're not counted as a mask. To me, this was red flags all over the place on who's advising our highest levels of government on how to prevent a pandemic from spreading within the White House and keeping our president and his staff safe.
I would guess that'd be Dr. Fauci, but who knows? We've got a couple of texts here. Alan writes to you, Dr. Kavanagh. Ask Dr. Kavanagh about the Great Barrington Declaration written by top epidemiologists. Why would they be wrong? Do you know about the Great Barrington Declaration?
I don't, but I tell you what, I'll Google it, read about it, and we can maybe talk about it early next week.
Here's another one that said, come on, Doc, why so negative? Medical treatments work. That's why we have medicine, research, and pharma.
Well, because they're right now not available for every citizen in America. And until they are, we need to live very safely. We do need to look for a vaccine. We do need to look at these monoclonal antibodies and also the antibodies that are the cocktails of two different types of antibodies. And these are very promising, but they're not available to everybody. I'm high risk. If I get a positive COVID test, I don't have the option of getting a monoclonal antibody on the get-go in order to delay or to prevent the symptoms from developing. So yes, I do think we're going to have treatments down the road. I think they're coming around the corner and are quite close, but they're not here yet. And so let's flatten the curve to push off the cases until these treatments are available. That's what the whole idea is.
All right. Speaking of vaccines, is there any news in that regard?
Well, none are going to be available before the election. There may be some that are approved by the end of the year. And as far as being available widely to everybody in the public, that probably is not going to happen to mid or next year. Now, if you're high risk or frontline workers, you'll be able to get them sooner. Of course, if you're low risk, you may want to get the most data you can on that vaccine. And so being last in line may be a good thing for you because the risk versus benefits, that's not the same ratio as someone, for example, that's in my category that has health problems and over the age of 65.
You've got some information that you supplied me with saying that New York City's spiking in certain zip code areas. What can you tell us about that?
Well, I thought this was interesting, and this is going on the test positivity rate, which is a better metric than the total number of cases. And their test positivity rate went from below 1%, which was when they decided to open their schools, to now over 3% in some of the zip code areas. I think it's about 9 areas, and they're closing down schools in those areas. And this is telling for 2 reasons. One is that New York City has a lot they have to do to upgrading their schools to make them safe during any sort of pandemic. Some of them are very dilapidated, do not have good ventilation with healthy buildings. But the other thing is, which I think is also very important, is that when you compare New York City's positivity rate to Kentucky's, ours is 4%. So when we're talking about, well, is the increase real in the number of cases? Is it not real? What we really need to realize is our positivity rate is still on the high end. It's not going down. Our hospitalizations yesterday were at 700, which is the highest they've ever been. We're still way too high, and we shouldn't be debating about whether or not things are going up, but we should be discussing how we're going to decrease them because we are at too high of a level. And so just comparing the public health measures that New York City's taking to what we're taking, we're, I think, a little bit on the lax side as far as wearing masks, social distancing, and making sure that we have safe buildings with good ventilation.
Okay. The New England Journal of Medicine, first time in history, more than 200 years, endorsed President Biden. Has he been running for 200 years? I knew he was older.
Yeah, he's older. He could have been running for 200 years. I don't know. They all could have.
I think what that means, they have never endorsed a presidential candidate before, right?
Correct. They have never endorsed a presidential candidate, and that is something that shows how concerned medicine is regarding how the pandemic is going. You can say that that's one group of people, they don't represent everybody, and that's true, but nevertheless, doctors have always taken the stance before, at least the majority of doctors, stating that we treat patients, we don't get involved in politics. But with this pandemic, the doctors really feel like things aren't being done the way they should be done, and they want to take steps to improve it. Now, whether that's on a local level, a state level, a national level, it's probably different in different areas of the nation, but doctors see a real red flag that this is a problem. And so we really do need to get active in our politics, active in elections, vote. That's going to be extremely important. And try to read many different sources so you make your own judgment on what needs to get done to get us out of this conundrum that we're in.
And I'm afraid we're out of time. We'll be